Patient-Centered Medical Homes Shared Savings Webinar, Part 1. Practices will receive support to invest in improvements and savings incentives to reduce total cost of care. Practice support payments, PBPMs, are used to invest in primary care to improve quality and reduce cost of care. Savings incentives are rewards to practices that achieve high-quality care while effectively controlling and/or reducing the total cost of care. These payments reflect the savings and the total cost of care related to the predetermined targets. To understand how the savings are calculated, it is important to understand what costs are used in determining a practice cost of care. The total cost of care for a practice is determined by the totaling all of the fee-for-service claims across all providers and settings. This is the total cost of all beneficiaries throughout the healthcare system, with a few important adjustments and exclusions to this cost. Some costs are excluded from the total cost of care. All beneficiaries' costs are capped at $1,000 for each beneficiary. Other select costs excluded from the total cost of care include behavioral health costs, developmental disability services, long-term support and services, nursing homes and transportation fees, and dental, vision, and neonatal costs. Practices will receive the greater of two savings incentives if they have met performance on quality. The shared saving incentives payments rewards practices that begin to realize savings by lowering their cost of care. If quality performance benchmarks are achieved, then practices are eligible for shared savings incentive payments. These payments are calculated through two methods. The first method rewards practices that provide efficient care by measuring savings against a statewide cost of care threshold. This threshold is determined based on the average cost of care for all Medicaid patients throughout the state. The second method rewards practices for managing growth in cost by measuring savings based on the practice's own historical cost. The practice's historical cost of care become a benchmark to measure cost of care against to determine savings incentive payments. Understanding key shared saving terms would clarify savings incentives and calculations. The cost threshold, shared savings entities, the historical baseline cost of care, benchmark costs, the performance period, and the practice risk score. In addition to the total cost of care, here are a few key shared savings terms that are important to the understanding of shared savings.